Hello, my name is Belet Lydia Ingrit. I want to present our research with title Women's Childbirth Experiences During COVID-19 Pandemic in Indonesia. Table of these contents including introduction, method, result, discussion, conclusion, and reference. From introduction about COVID-19, COVID-19 pandemic has become a worldwide health problem and has made the system health workers experience fatigue in overcoming existing health problems. COVID-19 has become a global pandemic around the world, including in Indonesia, which causes anxiety for the community. During childbirth, women usually have fears related to the process, effect of childbirth, concern about the health of the mother and the baby, and also fears about treatment from the health workers. Fear and anxiety from mothers who gave birth during the COVID-19 pandemic, of course, will increase. Seeing the importance of women's experiences during childbirth will influence the bonding attachment between mother and baby and the role of mother as a mother. The researchers want to dig deeper into the experience of giving birth during the COVID-19 pandemic. Disease spread of COVID-19 start from Wuhan, China at the end of December 2019. After China, there is a Depok in Indonesia since March 2 in 2020, with 2 patients identified as positive for COVID-19. This research has objective to explore more in-depth women's experiences during childbirth in the COVID-19 pandemic situation to develop nursing services, especially maternity nursing. This is our method, with ethical aspect was approved by the Dr. Riyadi Institute for Nanotechnology Ethics Committee, and study design with qualitative study with descriptive phenomenology design, and population or sample women in Indonesia who did not suffer from COVID-19 disease and had a history in birth during the COVID-19 pandemic in Indonesia, with total participants are 16 people. Inclusion and exclusion criteria. Inclusion, women who have birth during the COVID-19 pandemic, and participants willing to be research participants. Exclusion, women with COVID-19, physical and physiology disorders such as postpartum hemorrhagic, and psychological disorders such as baby blues syndrome and birth trauma. Study protocol. First, sample size was performed by purposive sampling method, and then take the saturation point. Number 3, when participants agree, they will fill out the informed consent. Number 4, the researcher interview participant by directly and indirectly via online. After collecting data from the interview, then the next step is to process the data. Number 6, process of the data analysis is using by the thematic content analysis stage of quality. Location and period is from June until September 2020, and the location take in community setting. This is the result. Description of participant characteristic, which include total of participant is 16 women. Location is from Jakarta, Tangerang, Surabaya, Manado, Medan, Maluku, Palangkaraya, Flores, Palu, until Papua. The average age is between 25 until 36 years old, with education background from senior high school until magister in nursing. Most of them work as housewife and working as a nurse, lecturer, and employee. Obstetric status mostly had one until two children and never had abortus history. This is the result from TAMS. TAM 1, feeling of anxiety and fear of giving birth in hospitals are experienced by women giving birth during the COVID-19 pandemic. TAM 2, screening for COVID and health protocol applied in hospital during the COVID-19 pandemic. TAM 3, support from husband, families, and health workers is needed when giving birth during the COVID-19 pandemic. TAM 4, lack of family visit hours is an obstacle during childbirth, particularly during the COVID-19 pandemic. TAM 5, bonding attachment between mother and baby while at the hospital. This is our discussion. Feelings of anxiety and fear of giving birth during the COVID-19 pandemic, supported by panel research in 2021, which said that majority of pregnant women in the third semester experience mild to moderate anxiety. Anxiety and stress also experienced by adolescent mother during the birth process during the COVID-19 pandemic, and getting poor quality of care during the COVID-19 pandemic. Anxiety was experienced for 3 until 4 months after giving birth during the COVID-19 pandemic. Padilla et al. Research said that apply health protocols for breastfeeding mothers and pregnant women, caregiver understand the correct use of mask and cough etiquette, maintain personal hygiene and home environment, and when visiting healthcare facilities. Support from the husband, family, and health workers are needed when giving birth during the COVID-19 pandemic. Also, pregnant women experiences during COVID-19 had psychological impact. Therefore, health workers support needed as positive experience for the mother. The Ministry of Health said the quantity of health workers who enter the treatment room, and only one person can accompany mothers who are giving birth by using an appropriate PPE or personal protective equipment. And the last one, TAM 5, bonding attachment is very necessary for mothers giving birth during the COVID-19 pandemic. Mayopolo said that postpartum mother with COVID-19 has separate room. Disease can cause psychological problems. Conclusion, based on our research, pleasant experience and not cause trauma will greatly affect mother's psychological condition after giving birth. Optimal maternity nursing care and support from husband and health facilities will help mothers give safe birth during the COVID-19 pandemic in Indonesia. And this is our reference. Thank you for your attention.